All right, so my name is Clement Avoka, and I'm a public health administrator currently working with the Allegheny County Health Department in the United States of America. My presentation, the title is Resilience Building for Children and Adolescents, Mental Health Across the Americas. This was a narrative structured to review study. And this is going to be the presentation outline. We'll run through the introduction to the conclusion. The review, like I said, started in May and ended in August 2025. And we synthesized studies from 2015 to 2025. The background, global public health challenge, of course, mental health has been the leading public health challenge in children and young adults in America. And globally, it is estimated that 1 out of 7 young people are affected by mental health disorders. And there is, our environment we live in constitute most of the stresses, the social media, technological factors, are all adding to the psychological burden on young children today. Despite there is a growing awareness, resilience building interventions are consistently, lacking or not integrated into the pediatric care systems. And mostly we would witness that the current pediatric care, often focuses on reactive treatment rather than being proactive to prevent mental health disorders. And that is why it is key that resilience building, helps to protect factors against mental health challenges, and intervention can improve emotional regulations, academic outcomes, and social functioning, especially among young children. So what were the objectives for this study? The first one, we wanted to identify and synthesize literature on resilience building interventions for young children in America. We also wanted to assess the type, setting, and the delivery models of these interventions and examine the outcome and effectiveness of these interventions, and then explore how early identification of mental health challenges can reduce long-term consequences. Of course, the last objective, we wanted to highlight research gap and offer evidence-based recommendations for integrating mental health into pediatric health systems. So we look at the problem statement, and like I said earlier, mental health disorders are the top causes of disability in children and young adults, with the rising rate of depression and anxiety among these children. Evident today is the increased school active shooting in the United States of America. If you are following the news, you would have noted that there is increasing active school shooting. And these are clearly mental health, issues, probably sometimes. And some of these young children are labeled as deviant, as stubborn, and we don't, pay much attention to their mental health issues. In 2021, a national emergency was declared in child and adolescent mental health. But resilience building interventions, like I said, are inconsistently and fragmentarily integrated into the pediatric care. Children with adverse adult childhood experiences are particularly vulnerable to, mental health issues. Yet evidence-based resilience interventions are not systematically incorporated into care. Therefore, a comprehensive review is urgently needed to synthesize recent research. And we did that, looking at data from 2015 to 2025, a 10 years period, to make sure that our data were current. And this, the gap hinders the ability of practitioners and policymakers to adopt scalable and effective strategies. So looking at the significance of this study, we are saying that the rising, public health challenge, as I stated, mental health, nearly 1 in 5 youth has a diagnosable mental health disorder annually. This is a serious public health issue. Resilient building strategies can help children cope with adversity and prevent severe mental health conditions. The gap, therefore, is that even though we are aware that there are proven benefits, these interventions are not systematically integrated into pediatric care, schools, or the community-based systems. It is therefore urgent needed for up-to-date consolidated evidences to be synthesized that can support policy making and decision making to ensure that resilient building strategies are incorporated into pediatric care systems. We therefore synthesize research from 2015 to 2025 to give practitioners, educators, and policymakers a roadmap and effective resilient building programs that will help us to address the health equity by exploring how resilient building can improve mental health outcomes for marginalized groups and youth, helping to close the existing disparities. The study also helped to, provide informed best practices, by successfully identifying implementation strategies and barriers to help integrate mental health promotion into pediatric and educational systems. The methods, we adapted the PRISMA guideline, that is the 2020 PRISMA guideline, to conduct this study. And we conducted a systematic search across 5 databases, including PubMed, the SciInfo, the CNL, Scopus, and Google Scholar. The time frame, like I said earlier, from May 2025 to August 2025, and 2 independent co-screeners reviewed the eligibility of the studies, and all eligible studies were exported to the Mendeley Citation Manager for us to be able to effectively, manage our study. The inclusion criteria was that intervention targeting resilience building in children and conducted between 2015 to 2025 were included. And the age group we actually concentrated was between 5 years to 19 years. In doing this, we came up with 17,752 records. And after we have taken out duplicates and other studies that did not meet the inclusion criteria, we were left with 34 studies that we extracted data from. So this is the presentation of the PRISMA flow. So we excluded from the, the right-hand side, we excluded 240 studies because they did not meet the inclusion criteria. If you further go down there, where we did the full text article assessment, we also further excluded 26 studies, and these were the reasons. 2 were protocols, 14 had no evidence involving resilient building, and 6 had no evidence of involving children or adolescents. And lastly, 4 studies um, were review studies. And the results, that is looking at the intervention setting, we realized that schools were the most common, setting that if we want to have effectiveness in resilience building, most of the studies or the strategies can't be incorporated in school-based programs, where we have the um, the social um, the social and emotional learning materials and trauma-informed curricula, can be very effective. And then we also identified pediatric care, where integrated behavioral health trauma-informed approaches were also, identified. Community-based, where cultural identity, peer mentorship, local adaptations were also, uh, one of the common areas that pediatric activities or resilient building activities can take place. Then the digital platforms, where we have the online and hybrid programs, especially during the COVID-19. Then we continue to still look at effectiveness of these, these settings. And then we realized that the social and emotional learning, as well as the cognitive behavioral therapy programs, help to reduce depression, anxiety, and improve the pro-social behaviors. Then we also noticed that trauma-informed care lowered the post-traumatic stress syndromes, disorders, symptoms, improved family relationships, etc., etc. We also realized that culturally adopted programs enhance identity, reduce stigma, and boosted engagement, that is at the community level. Then early identification linked to reduce long-term risks and improved academic outcomes. Key findings continue. We also noticed that schools remain the most scalable and effective delivery platforms, therefore making it one of the preferred, settings that we should concentrate integrating resilience building strategies through that, platform. Pediatric care offers early identification and opportunities. Then community-based and culturally adapted models also help to reduce disparities. Digital approaches expand access but risk the digital divide, where children may be accessing inappropriate content that could, even lead them to be isolated the more. Then sustainability and long-term follow-up remains a challenge, calling for further research, primary research. These are some of the recommendations we made. We recommended that mandatory universal mental health screening in schools and pediatric care is necessary. And also there's the need to train teachers, pediatricians, and community workers in resilience promotion. There's also the need to fund culturally adapted, community-driven interventions. Also, investing in long-term scalable implementation studies is going to go a long way to provide evidence-based data to support in resilience building integration in pediatric care. Institutionalized family engagement as a core intervention element will help a long way to improve relationship and family bonding. In conclusion, resilience building interventions are effective across multiple settings, and it is therefore very necessary to explore these settings and make leverage on their effectiveness in the integration of resilience building strategies that can help us to identify early and intervene to minimize adverse outcomes of childhood mental health problems. Cultural adaptation, early identification, and family engagement are key settings that can help to improve mental health outcomes. Policy and system level integration are essential for sustainable impact. Future research must focus on equity, scalability, and long-term outcomes. I want to thank you so much for your attention.